Mr. Quattrini, do you want me to address the closing that we had today?
Please.
Okay. So I wanted to share with the board, I've shared information from Saturday and Sunday. I sent voice messages out to our families in the school community, both on Saturday, 2 on Sunday, and a third one today, to return and be prepared for in-person and remote learning back in session starting tomorrow. The closing today was a result of the recommendation from PDE and the Department of Health that when you have one or more positive case in your school system and your county is designated as substantial, that our school district resides in, then we should close for a period of time. Also, the factor of looking into the data to see where it is located around the county and the variety of zip codes, to give the public health staff the time they need to do the contact tracing, as well as provide us as an administrative team today to review and monitor the situation and make decisions on next steps based on our population within our school system. So with that, we're ready to roll, to go back in. I want to share with the team that because on Friday, the state designated our county as substantial, Pennsylvania Department of Education is holding a superintendent meeting tomorrow morning at 10:30 with the 7 superintendents in Bradford County. So from that information, once I acquire more information during that meeting, I will share that out with the board and the school staff and then the families.
All right, thank you very much, Dr. Delosio.
You know, I thought of something else, Mr. Quattrini, if you don't mind. I did have a few parents reach out and ask why we had closed both buildings when I had mentioned in my initial message that it was a member of our elementary staff. And the reason that we closed both buildings is because we share staff across both buildings.
Yeah, I think that was just the right thing to do.
Okay. Yes,
Dr. Dill,
yes.
I did reach out because I was having some technical issues to Mr. Handrick to ask you a question. I had a parent contact me that they had received notification from the district regarding a child quarantining, but they have yet to hear from the Department of Health should their child still stay home. And I know Dayton was going to reach out to you and Michelle about that. I think Dayton said that yes, if the school district told you you'd probably be quarantining, the children should not return tomorrow. But do you think you could speak to that?
Absolutely. So I was on the phone. The first step in the process when we find that we have a positive case within our system is to reach out to the director of the IU, who puts us in immediate contact with the Pennsylvania Department of Education's rapid response team. The rapid response team called me within 15 to 20 minutes of receiving that information, or between the time I hung up the phone with Dr. Reed and the time I received a call from the rapid response team. They took down all the information and told me that the Department of Health would be in contact with me within 24 hours. I received a call from the Department of Health Sunday morning around the 11 o'clock time and went through information with them. And so they asked school systems, they say they'll be doing contact tracing at the same time. If we have the seating charts, which Mrs. Morel did an outstanding job putting all of that information together and ready to roll, that it's nice if the school does a secondary call, although they're, I believe, right, so my understanding is that they probably have a list and try to go in somewhat of an order. And we probably then, we gave them a 60 to 90 minute lead time. And we probably ended up jumping ahead of them. So even as of today, my understanding is that some parents have yet to receive that call. So I reached out today to my contact at the Department of Health, and she reached out to her supervisor and got back to me and said that they were under the understanding that the contract tracing had started, apologized and said that they would get on that. So that's the information I have. Mrs. Berry is a follow-up, but I know that it was, our job to do a secondary call. And sometimes we ended up, well, in all cases, we ended up being the first call.
So those children or families that receive the contact from the district should stay home until they hear from the Department of Health then? Or, I'm sorry, I guess that's the confusion is.
Yeah. So my direction from the Department of Health, some of the same information they're going to get from them and maybe a little bit more from them, is that those that were in contact, anybody, staff member or student that was on the list, will quarantine from the last exposure out 14 days, which runs until the 16th of this week, which is Friday. And so those individuals who got the call can return on the 19th, based on the information that I received.
Thank you. I just wanted to make that clear because the parents that haven't yet heard from the Department of Health were a little confused.
I completely understand. Thank you.
Thank you.